Pre-certification and pre-authorizations are similar, but pre-certification doesn't guarantee payment for services. Each company has its own requirements for pre-certification. Um, However, the process for both of them are pretty similar. Um, you call the provider's services phone number on the card for the patient's health. In other words, call the insurance typically in this case. Provides the insurance company with procedures and services that are being requested, the diagnosis for why they're doing them, and then document the outcome of the call in the patient's record. So basically, what they're saying is you call the insurance company and say, "We'd like to pre-certify this particular patient for this," and they'll ask you patient's information, what's being done, why is it being done, those kind of things, um, and then they will give you a pre-certification number that you write that follows that particular claim through the process. Workers' compensation is another big part of coverage in healthcare and benefits. This was years ago referred to as workman's compensation. It is no longer that term. So if you hear somebody say it, that's technically not correct. It's workers' compensation. There are laws in every state that apply to workers' compensation to protect workers from um, losing basically their salary and whatever it's costing them for medical services. If they are injured at work or if there is a disease caused by something they're exposed to at work, as long as the employee was not proven to be negligent. In other words, if the employee did something totally wrong, and by uh, that particular instance caused them injury, then they can choose not to make coverage. Um, it is a plan for individuals who are injured on the job or as a part of a job related circumstance. And what they're talking about in job related circumstances, yes, if they're physically in that particular building and they're working in that building, okay, that's basically a on the job. However, if they are traveling for work from one place to another place, let's say they're going to get equipment, they're going to do something that is officially on work and work time, then they may still be covered under workers' compensation. So it covers medical care and rehabilitation, weekly income if that's needed, and death benefits if that particular incident was the cause of their death. Disability insurance provides income replacement for someone uh, who was injured or in a situation that was not work related. There can be short term disability or long term disability. Short term is generally about 9 to 52 weeks. Long term disability is going to pick up after the short term ends, and it will pay uh, until the patient returns to work or for a limited number of years, according to the policy. Life insurance is another type of insurance coverage that may be in play. It provides payment of a certain amount when the person passes away. So after their death, then it can go to their estate or it can go to a designated beneficiary, a person that they designated to go to, in other words. In a lot of cases, like for instance, um, a married person may have it going to their spouse, for instance. Um, the healthcare facility may be required to complete physical forms whenever that person applies for insurance. In an annual annuity policy, the provider will have to determine whether a permanent disability is present and turn in the documentation. Long term care insurance is some that covers um, a lot of maintenance and health services for the chronically ill, for someone who's disabled or developmentally delayed. Um, The services are provided on inpatient or outpatient basis or at home. Um, Long-term care is typically an inpatient type of care. Liability insurance covers um, the losses of a third party in an insurance claim. Um, they are payable to the victims who may be injured in that the business's um, car or home or those kind of things. Um, and it doesn't matter about the insured person's legal liability for the accident or anything like that. Um, types um, are automobile insurance, which we know a lot about that one already, business insurance, covered against losses there in a lot of cases, homeowners, of course, that's protecting homeowners from injuries by another person on their property, even those kind of things. Um, includes benefits for medical expenses resulting from a traumatic injury, for lost wages, and sometimes for pain and suffering. The Affordable Care Act came into play in 2010. It increased the level of availability of insurance for affordability of private and group plans for 44 million Americans. Uh, the idea is to reduce the overall healthcare costs and the cost of spending. Um, insurance companies can't drop the patient uh, and their coverage if the patient gets sick or makes an intentional mistake. So, in other words, used to be there were insurance plans out there. If they actually used the insurance, they would get canceled. So, this is going to prevent them from doing that. Um, patient coaching and legal ethical issues um, are going to include the patient being informed and answering questions as they come up. Um, using good communication skills and patience and tact uh, in the discussions with the insurance companies and also in the discussion with patients regarding insurance. Written release has to be given before any medical information can be given out of the record, um, and also advising the patients and helping them to be more comfortable with the insurance experience, um, and collecting the fees at the end of all of that service.